Hi everyone, Dr. Numi from Pain Free and Fit and Posture Size. Today, a great exercise for those of you with either degenerative disc disease, spondylolisthesis, or if you have both, even better. This is an exercise for our spinal extensor muscles known as the long lever standing band pull. Hope you enjoy. So many of you subscribers have written in and asked for exercises that address both spondylolisthesis problems of the lower back and disc problems, degenerative discs, herniated bulging discs. So this exercise actually is great for if you have one of those entities alone or if you have both, because it develops the spinal extensors in such a way to really stabilize the spine. Disc problems in the lower back, remember, typically are aggravated with flexion, bending forward. So we try to build up the extensor muscles to bring us backwards. Spondylolisthesis, many times we have to emphasize flexion muscles, but as you've learned in our previous videos, the deep fibers at L5 and L4 of the erector spinae muscles attach to the vertebra in such a way that if we contract them while holding a little bit of abdominal tension, so we delete the extension effect, we get a backwards pulling effect of those lower erector spinae fibers on L4 and L5, and that helps to hold the spondylolisthesis so it doesn't go forward. So this exercise is actually going to be good for either of those problems that you have, or even better, if you suffer from degenerative disc disease with spondylolisthesis, which is a very common situation, great exercise for that also. So many of our other exercises, we talk about spinal extension or bending backwards using different levers or moment arms, meaning distances from the center of where we're trying to work. Today we're actually going to be using a resistance band at the neck and head to produce a long lever effect on the lower back. As I back up with this band, if it stretches, and by the way, I'm using a pretty thick band. This is a powerlifting band that goes at about 180, 200 pounds of resistance. You don't need to start with that. You can start with something very small, maybe a thin band. 10, 20 pounds of resistance is fine. Just for demonstration purposes, I'm showing you this with the thicker band. As I bend backwards with my head, meaning cervical retraction, I'm going to take my head from a forward head posture and pull it backwards, which in itself is a great correction for many of those with degenerative disc disease, because many times degenerative disc disease is associated with forward head posture, which then the torso follows the head, like when we're sitting and slumping, working on computers, and that then flexes and aggravates lower back disc problems. So the exercise is simply pulling the head back. But even though this is a neck strengthening exercise, it's going to light up all of our extensors from our head all the way down our lower back. And here's what we need to do for spondylolisthesis and degenerative discs of the lower back. You're going to, with your thumbs, feel the midline bones of your lower back. And if you feel just to the sides of those knobs, those midline bones, the lower sides, right and left, that's where your multifidus muscles are. The multifidus are the extensors. When you pull your head straight back, you'll notice that there's tension that will pop up under your thumbs. That's the multifidus muscles contracting. So the multifidi are great because many disc problems, they're weak, and they help to extend the spine and help us to maintain a neutral spine position where we're moving, bending, lifting, working out, so we don't get that flexion effect like when in the middle of deadlifting, squatting, overhead pressing, whatever it is. So, in addition to the multifidus, after you feel those muscles tense right against the bones with your thumbs, I want you to move the thumbs out about 1 inch to both sides. That's your erector spinae tendons. And what we're going to do is, as we pull the head back, we're going to notice that there's tension under those muscles as well. Now, if we don't think about using some tail under or pubic bone up pelvic tilting in a posterior direction, those erector spinae muscles, when they contract, while it may be good for disc problems, may actually irritate spondylolisthesis. So we need to complement that contraction of the extensors with a little tailbone under tension. Again, if your RPI is to pull your tailbone under, then go ahead and do it. If your RPI is to bring your tailbone up, then you don't need to actually move it under, but simply tense it, as if you're using your abdominals to lift your pubic bone, but not actually rocking the pelvis. That abdominal tension that you're developing is going to negate the extension effect, meaning that it's going to prevent the lower back from arching, and that's going to light up the backward or posterior translation force of that lower erector spinae muscle, so you get the breaking of the spondylolisthesis. So you prevent that spondylolisthesis from going forward. You're going to be developing the strength and endurance of the erector spinae to hold it or to check it back in its normal position. So you can hold that anywhere from 3 seconds to 5 seconds and then release. So that's the exercise. If you have a weak multifidus, if you notice on one of the knobs, you want to focus on contracting more multifidus muscle because you don't feel much tension there or a hollow there, then just zoom in on thinking that that area is going to bulge out a little more. With practice, you're going to feel that. If the erector spinae muscles are contracting too much, you need to hold your tail under. You'll know they're contracting too much because as you pull your head back, you're going to feel a little lower back pain because you're actually getting extension. You can put your hands on your lower back and notice that if, as you pull back, that tail comes up and you arch your lower back, you need more abdominal tension and holding that tailbone under or that pubic bone up. So the spine is held in neutral as I do my repetitions. Now I can do that initially on a straight vector, pulling straight back. That's a long lever. My head is trying to be pulled forward by the resistance of the band. My lower back muscles all up to my neck are resisting that forward motion. I can also do that though on a diagonal. I can turn my body and my head, so now I'm pulling my head in line with this band, not just straight back, but also to my right side. And here you're going to feel a little different tension on the erector spinae muscles, but it's training it at different angles to maintain a stable spine. The beauty of working with a band is, besides just if we were prone, let's say, laying face down and pulling our head back, the band reproduces an unstable, unexpected force. When we're walking, we're working out, we step off a step, there's a perturbation or a change in our posture that many times creates an extension in our lower back. Anytime you're working out, you're grabbing something, something slips, someone bumps into you, if you get that extension in your lower back, many times that's going to aggravate your pain, your spondylolisthesis, your posterior disc herniation. The beauty of working with a band in standing position is it gets you used to absorbing this force from above and this quick accent or need to extend the spine. And it trains you to check that and make sure the spine doesn't arch as you're contracting these erector spinae and multifidus muscles. You can do those for reps. It's better than static holds because each rep is training you to, with this force of coming on and off, trying to extend your lower back, which would happen if you didn't use those abdominals to check it. The low back would arch. It's training you to check that each rep, and that gets into your nervous system and trains you to hold your lower back in a neutral spine position, avoiding that extension aggravation, that overarch aggravation. Use this one for increasing reps with a thin band up to 50, 100 reps. Eventually, you can also put in some isometric holds, 30 seconds, 60 seconds, up to a minute or two. You can even do that on a balance board or a one-legged stance to make the instability in the exercise harder to make sure that you're not overarching that lower back. If you like this video on spondylolisthesis and degenerative disc extensor training, feel free to subscribe to our channel. We got a lot of great videos out there for both entities. Questions or comments, write in. I'll do my best to answer them. Thumbs up to help me share this vital information with others that are suffering from low back pain and want to get in shape. And remember, if you're looking for a custom program for you, learn how to identify your unique posture, mechanical stability problems that are in your body that are aggravating your degenerative disc disease and or your spondylolisthesis and preventing you from getting back into fitness and activities and sports, check out our fast track program. We have one for spondyle and we have one for degenerative disc disease at the painfreeandfit.com website. Goes through a full body analysis, teaches you how to stabilize your unique spine for your unique condition, and all the stretches, strengthening, endurance, and stability exercises that you need to get yourself back into sports, back into fitness without aggravating your low back pain. I hope this long lever spinal extensor training exercise helps you with your chronic lower back pain.